information that is going to keep you occupied during this pandemic. Now, in this particular hour, we're going to be looking at tobacco and, of course, tobacco control in Uganda. What is tobacco? What are some of the misconceptions around it, even in these times that we are living in of COVID-19. With me in studio is Baguma Richard Tinkasemire, a coordinator from Uganda Health Communication Alliance. Now, this is the NGO that is on the forefront of tobacco control, making sure that it is controlled in terms of supply, in terms of consuming it, and other products that are related to tobacco. It's a pleasure having you, Richard.
Thank you very much.
How are you doing?
I am doing good.
That's good.
It's nice, it's quieter, and fresher outside.
Well,
yes.
Fresh, I'll take fresh out of it. And thank you for fixing time to join us. Now, I want us to get right into it. Tobacco is one of the biggest public health hazards, if I'm to say, but one may ask the magnitude of this danger.
The tobacco, I think, globally, is the second human killer after cancer. I think tobacco kills, and then of course tobacco is related to cancer. So, but tobacco use kills more than 8 million people every year around the world. The thing that's very painful.
It is very painful.
Those are too many lives which are perishing because of a preventable situation. Because you can live without consuming tobacco and then you'll be healthy. So it's preventable death. What aggravates even the situation is that just over 10% of the 8 million, close to 900,000, die every year because they don't smoke themselves, but because they are either second-hand or third-hand smokers, but mainly second-hand smokers. So that people die of a product that they are not consuming themselves, but somebody around them is consuming it, and they die. Now, those are the ones who die, which means that by the time you die, you have been sick. Because for tobacco use, it's not sudden death. It's never sudden death. It's slow, it's painful, and drawn out. So when you take the diseased, then you have millions who are sick or in the process of falling sick. When you come to Uganda, we estimate that we have about 38 people who die daily.
Wow.
In Uganda. Tobacco kills way more than malaria. People talk about malaria. People fall sick of malaria, and it's dramatic. So you feel the sickness immediately, and you feel the pain, but you have more people dying of tobacco use globally than when you combine the deaths of malaria, HIV/AIDS, and tuberculosis. When you combine the three diseases, they don't kill as many people
as tobacco does.
As tobacco use kills. So the situation is, in Uganda we estimate that there are about 38 people who die. Now, we do not have totally updated information because we do not have an entire population survey that has been done. But the surveys that have been done by Makerere University, by the Makerere University together with the Economic Policy Research Center of Makerere, the School of Public Health, very competent institutions, estimate that there may be about 38 people who die daily in Uganda. If you take in terms of disease, I can give you an example, just one example. At the Cancer Institute, Uganda Cancer Institute, it's one of the, I think it was a doctoral student was doing a study, and they found that over a period of 10 years, 75% of the patients who had been to the Cancer Institute with what they call oropharyngeal cancers. Oropharyngeal cancers are cancers of the oral cavity and the esophagus. So the mouth, the tongue, the throat,
the gut.
The gut. And you know all those get cancers because of tobacco. 75% of those patients had a history of tobacco use. Now, when you take in epidemiology, when you take statistics of health, a contributor to 75% of sickness is such a huge contributor. But I think anything contributing 70%, 75% to anything,
it should be serious.
Is serious. You know, globally, you have close to 1.2 billion human beings who smoke.
Wow.
That is how. There's probably, we don't know about another product that is probably consumed
more
across
than
the
tobacco.
globe, that it is the same brand, that they are the same manufacturer, same owners, tobacco. So it's huge. Uganda has done a health cost study. The health cost study that Uganda did found that we spend about 330 billion shillings to deal with the problems that come with consumption of tobacco. So that's how big we are.
We are talking numbers. We're talking over 8 million people dying annually around the globe due to the consumption of tobacco. Now, that is undoubtedly a big something to look at. But right now, I want us to shift our attention to the times we are living in right now. What do we know about tobacco and the vulnerability of diseases like the one we are battling right now of COVID-19?
You see, when you see tobacco affects all organs of the body. Tobacco is a plant which by creation, by nature, has a lot of components. All living organisms have a lot of components that make them. Tobacco has a lot of components that make it. It has been found that of the chemical compounds that make the crop tobacco, more than 40 are poisonous, are toxic. In chemistry, they say, science, they say carcinogenic. More than 40. So you have more than 40 carcinogens or poisonous substances in the crop called tobacco. By nature, that's how it was. So anything, and therefore it hits the body when you use it and hits it hard. But when you see, it hits the parts of the body most. Because you find it's the biggest contributor to lung cancer. It's the biggest contributor to issues of health and gut and what. Where does COVID hit? COVID hits the same body parts.
The respiratory organs.
And so, how do you consume tobacco mainly? Either sniffing, or chewing, or smoking. The body parts which COVID hits most are the same body parts which we use generally for consumption of tobacco. And because tobacco is poisonous, it has already made them very weak. So you have a higher likelihood that somebody who uses tobacco in any form is more likely to succumb to COVID than the one who doesn't. Therefore, tobacco use becomes a high risk factor for the COVID challenge. And so that relationship is what we are talking about.
So in this case, I want you to confirm this, that people that have actually in the past or have an experience of tobacco consumption have higher chances of dying of COVID than any other person that has not been using tobacco.
Absolutely. You see, there are two things, because you have brought the one people who have had a consumption of tobacco, a history of consumption of tobacco. The ones who are real in danger are the ones who are using. The ones who are using now. Okay. And I've been told shisha has shifted to homes. But also those who are near users, because remember we said the second hand, those who don't necessarily use but they are around users, are also at risk. Higher risk, yes, than. And if you look at the statistics, for example, look at the statistics of COVID in Uganda. People have been sick.
We are at 100 now.
Yeah, but people have been sick and they have healed. If you are a tobacco user, you have less chances of healing than the one whose lung health, whose throat health is good. Because the body health is the first defense against a virus, especially flu. like COVID, which has no cure. So when you reduce or dent your body resistance, your body health, then you are opening yourself up to high risk for COVID. And that's really what is the situation now.
What chances does one stand now? I'm talking about two people. This is the direct smoker and the passive smoker. Do they suffer the same fate?
Science does not, nature does not allow people to suffer the same fate. No. You can both be exposed to a mosquito bite. One develops malaria, one doesn't. Yes, because of the body response to it. It is the same with tobacco. It is the same. You can take the same meal. Somebody gets food poisoning and gets problems that are known, another one doesn't. So our bodies are built differently. We have different levels of resistance. We have different levels of reaction to different chemicals and germs and viruses. That is why, even with COVID, you have the people who are exposed and are just carriers. This is the same with HIV. We know that some people, that's why you have discordant couples.
Yeah.
So
some are living with HIV and others have AIDS.
Just that the risk you face because you are a tobacco consumer or you are around those who consume tobacco, your risks to succumbing to COVID are higher than the ones who are not. Whether you are a second-hand smoker or you are a first-hand smoker.
I hope you heard it right from the horse's mouth. I don't think that you stand a higher chance if you're still consuming tobacco or even if you're around people that actually smoke this particular product. But here in Uganda, we have some acts like the Tobacco Control Act of 2015, which actually bans the advertisement or even the promotion of tobacco products, but we still have some arguments of safe tobacco use. You know, the merits say it clearly that it is safe to use tobacco, but they actually taint a good picture around tobacco usage. Now, who is fooling who in this particular situation?
Let me tell you, one of the greatest concerns I've had during COVID is the surge in the unproven science about the possible, because no one says it's working, but the possible positive element of tobacco towards COVID. I mean, really, this is absurd. The second concern I have is the improving image of the tobacco industry because of COVID, because they have come out powerfully to contribute to the COVID effort. So they start looking like angels. But you see, Lucifer comes in many forms. Lucifer can also disguise as an angel. Lucifer can disguise as a prophet. So this is what we are seeing. That you have the tobacco industry, the driver of doom, really, because they vend a product, they produce and vend a product, which is poisonous, and it is known, which causes disease, and which causes death. Therefore, when you come to contribute at my funeral, when you are the one who sent people to kill me, should I clap my hands? That's the sadness I feel, because the tobacco industry starts looking good, and then it gets all this positive coverage. And so the Tobacco Control Act and its provisions, the bans you are talking about, because of a crisis, they get relegated. The Tobacco Control Act that you're talking about actually stops government. It's by law, and it was passed by government, passed by parliament, itself, signed by the president. It bars them from taking any freebies from the tobacco industry. So the president was actually acting illegally. The prime minister, the task force, COVID task force, was actually acting illegally according to the Ugandan law. We have not lifted Uganda law. We are not in a state of emergency.
Just because we are living in a pandemic.
To take the tobacco industry freebies and advertise them, praise them so much. That's illegal. But you see, in a crisis time, these things get relegated conveniently. And the tobacco industry is taking advantage of this crisis to promote itself. Look, they tell you that, you see, when you are stuck at home, then tobacco is your companion. When you are stuck at home, surrounded by your loved ones, and you are using tobacco products, and you are infecting everyone around yourself, and Oh, what kind of love? That's that love? No, thank you. So yes, I'm worried that the Tobacco Control Act is being relegated because of the COVID crisis, yet we know that tobacco in the short term, and as always in the long term, is going to generate a crisis for us, even post-COVID.
I think this, what you just said here, if the Tobacco Act itself is being rallied, it will, don't you think it will shift its objectives? Because if you're to see actually objectives of this act is to actually reduce the supply, the consumption, the production, and everything to do with tobacco. But the fact that it is being swept away, and we are seeing our very own government putting its hands forward to receive any benefit from the tobacco industry, don't you see that Ugandans are going to go back to the notion where they thought that actually this act or this law is there to maybe enhance the consumption of tobacco?
Yes, and you see, it's a global, but it's actually a global problem. The tobacco industry, you see, look, the tobacco industry is owned by the same people. There are a couple of companies. If you look at them, they are all interconnected. The ownership is. That's why you have a company called British America. Why is it not Uganda and Kenya? Why? I mean, do we stop to ask ourselves? So, and these companies are rich. Because if you have more than 1 billion clients every day, even if the people are smoking one stick only, and we know they don't, and they are buying it at 100, it means you are getting more than 100 billion shillings every day. What can you do to such a business? And so they take advantage. I call it okubegura. They a little thing, and they dangle it in front of all of us, all crowd with task forces, and we think they are, no, excuse us, you are killing us with your products, and killing us with those huge amounts. And you are relegating the law that took us so long, and you are relegating all the education and all the sensitization. So yes, this is very, very worrisome, because the industry has also changed tactics. The industry is targeting margarine, by the way.
Yeah.
It's targeting this young corporate female. That's why when you look at the products of the tobacco industry, they have innovated flavored products, because they know we love chocolate flavor, we love vanilla flavor, we love what is the other, strawberry flavor. They have turned their products, now they are giving them flavors. First of all, the flavor is attractive because this individual is already has a positive associations with that flavor. But two, it covers the terrible smell that tobacco has. So it's easier to market. They have innovated nice looking, attractive products. So that's why you see there's what they call the electronic cigarette now, the e-cigarette or the vape. Yeah. It's either gold or it's silver.
It is actually appealing to look at.
Absolutely. Then they were telling me that the colors are beige. These are some of them. I don't know these colors. But I talk to young people a lot because we have to discuss tobacco control. It's attractive to look at. It is easy to carry. So it is easy to conceal because people know that tobacco use will be condemned or looked at negatively. It never is looked at positively. So people hide. It is easy to carry. It is easy to refill, but it is also easy to charge because it charges the same way as electronic telephone or computer. So the industry has been very innovative in packaging, in promoting, it's distributing its poison. And so it's a way of fighting the act. Because we are talking about distribution, we are talking about marketing. So it's a way of going around the law creatively. Because these are new products that you don't even associate with tobacco. And they don't even call them tobacco. They even struggle not to call them tobacco. So it's supposed to be jewel or vaping or I don't know, they have all these kinds of names. Fancy, sexy, you know, because they have the money to understand the mental characteristics of the client, but also not just the mental, but also the type, the appeals to the human being. And this is scary for us.
These innovations you're talking about, the packaging and the names, the different names that are being given, the addition of flavor, could they have attributed to the heightening numbers of women and the youth actually? Because statistics show that women are actually consuming tobacco in Uganda more than ever before.
Yes, if you look, we are waiting for the latest figures. But if you look at the ones that were published previously, when you take percentage increase of consumption of tobacco between men, young men and women, we are talking about, because the average age of consumption of tobacco in Uganda is 13. The average initiation age is 13, senior one, just about. When you take that one to up to about 27, the rate of consumption of starting tobacco between the male and the females are taking on higher
than the males.
But this is also clear because science telling, but science does not tell lies. The industry, the tobacco industry, has been deliberately targeting the young female, the youthful, upcoming corporate female. And this is understandable.
Because they were not partaking before?
Absolutely,
or why?
because it's a virgin market. It's a virgin market. It was the men who were taking. It's a virgin market, so you have to deliberately cultivate it to grow your profits and to grow your consumers. You take your poison to them. I mean, it's a very obvious marketing approach.
Strategy. Mm-hmm.
Yes, absolutely, strategy. But two, you are dealing with a female who is becoming more empowered, educated.
Because it's true, females are studying more lately.
Oh yes, a little bit more income, a little bit more freedom to do what they would like to do. So community society is no longer having that oppressive, pervasive dominance it was having on the female. So when you look at a virgin market, but a market that is increasing in its capability to spend, it has a little bit more disposable income and a little bit more freedom to act the way they would like to act, whether it's right or not. These are very fertile conditions for growing the tobacco use pandemic.
All right, right there, I want us to put a pause on that, and we're going to continue with this very conversation of how women are being targeted the most by the tobacco market to be able to tap into what would be called the virgin land. We're going to continue with this after these messages. Do stay with us.
Smart 24. Smart Business.
Soka nze MTN njagala era ne namba yange yeri ddala eryaba corporate enkadde 0772436333 kati MTN kyenjagaddeko ekisooka nti mobile money yaabwe yanguwa ekyo kimu ekyokubiri etwangwiriza katusasulirako ki amabanja oba yagala okugula ebintu kati mu kyalo otusasulira nosindikira omuntu ku kyalo. ate naano mu COVID-19 tuyambe nnyo obutakwata nnyo ssente kubanga batugamba social distancing ne bagana okunaba mu ngalo naye ssente tezinaba mu ngalo zikwatibwako abantu bangi nnyo 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 oyinza okukwata ssente nga zikwatiddwako abantu abalala kuba buli muntu azaagala. Bw'omala ozikwata oteeka mu nsawo tonaaba ngalo neweekwatako olaba gundi risiki gy'oliko kaakati essente ziyingira mu nsawo zibeera mu nsawo kati we zijja nga ziriko obuwuka ne bukusaasaanira ate buli kaseera omuzeto ogukwata mu gundi mu nsawo ogumanyi buli wokwata mu nsawo okwata mu face buli wokwata mu nsawo okitaba. So MTN nakyo kituyambyeko nze kati ebiseera bisinga nkozesa mobile money.
Everywhere you go, MTN.
World Vision International is an evangelical Christian humanitarian aid, development and advocacy organization. It prefers to present itself as interdenominational and also employs staff from non-evangelical Christian denominations. The community-based input of World Vision Uganda is undoubtedly felt in communities in the country. World Vision went out of stride again to donate various items ranging from safety, medical and sanitary equipment. In total, World Vision Uganda has made a donation worth $1 million. Support the government. Dial the numbers on the screen of the Joint Task Force and be part of the people fighting the spread of the virus in Uganda.
Let's talk about manufacturing in Uganda, shall we? how are you going to price the goods that have really been manufactured at a very high cost during this period?
The individual companies are busy working that out to identify avenues of keeping cost low in order not to impact the final consumer product price.
What are some of those areas that you're earmarking in the recovery plan post-COVID period?
Our recovery plan looks to stimulate demand, but it also looks to ensure that our productive sectors continue to thrive.
Smart 24. Smart Business. Smart After Breakfast is brought to you by MTN.
Thank you for keeping it Smart 24. It's just 8 minutes away from 1 p.m. this lovely afternoon. Thank you for joining with us. And of course, for those of you that are just joining, Smart After Breakfast is the show you're watching. We're still discussing tobacco consumption, tobacco control. And before we went to the break, Richard here was still trying to tell us how actually the industry is growing enormously in different innovations, where we're having products now having some additions to it in terms of flavors. Now that is bringing about the high numbers of youth or young women consuming this tobacco. And amidst that, this is another thing I wanted to bring to your attention. We see that amidst the Tobacco Control Act of 2015, we still see Ugandans enjoying other rights. Well, their rights. Now that the act does not stop a Ugandan from enjoying the right to smoke, but actually just provides the 50-meter rule or distance from one another to make sure that you're not affecting the other. And that is just an example. We see other rights that Ugandans enjoy, which actually give them the liberty to continue consuming tobacco or even tobacco products. Now, where does that leave a country like Uganda? Do we ever see a day or a dawn when there will be actually a reduction in this consumption, because actually the deaths keep adding up? I'm talking about the rights that Ugandans enjoy. Do you think these are also key players in how much they consume or take in the tobacco products?
The tobacco is one product that is that is interesting. Interesting in the manner that the world is struggling with a product they know is poisonous. They know costs lives and costs money to treat and disturbs health systems. It is known. An industry that does a lot of child labor, that is exploited, but an industry that is also very powerful, very rich and very pervasive in governance, in legislation, in court. They are always going to court. They have the money to pay the best brains, legal brains. That they have money to pay all these kinds of non-peer-reviewed research, but it's promoted as, So why it is even more interesting, tobacco is the only legal product in the world which kills you when you consume it as it should be consumed, as prescribed by the manufacturer.
But even as they legalize it, they realize it's death itself.
So the tobacco industry, in all its literature, does not deny that its product kills. It doesn't, because science has proved that beyond reasonable doubt. And so they bring those arguments of, for example, rights. That you have a right to take a product even when it's going to kill you. I keep telling people that if they found you holding a gun going to shoot yourself, they will arrest you. You don't have a right to use the gun to kill yourself or to use an acaricide to kill yourself. But you have a right to use tobacco to kill yourself.
Wow.
This for me is a contradiction. It is the only product in the world that kills the users, 50% of the users actually, get sick or have problems when they use it as prescribed. Because how do they tell you? They tell you get it, light a fire and smoke it. That's the manufacturer's instructions. And it still kills you or makes you diseased. It's the only product. And that's the contradiction that I'm talking about. And so yes, when you talk about the rights, now we shift to the second hand, smokers. Okay, if you want to claim the right to kill yourself, which you don't have actually, but because in the case of tobacco, because how powerful it is, no legislator, no official is touching it. Question that. But how come you have a right to kill those around you? Because this product is going to kill them and make them sick. You dare get a stick and hit another person, even when you're not going to kill them, but you're going to give them a bruise. You will be arrested instantaneously and charged. But you see, when you are smoking around people, you are assaulting them. You are assaulting their health. You are endangering their lives. So why should the question of rights arise? Just imagine people's workplaces. If you come here, Madrin, to Smart TV, and anybody does as just push you, you'll be up in arms.
Yeah.
The whole world will be shouting about harassment and about violence and everything. But somebody comes and smokes
near me
by your side, and the world is not listening to that assault.
Or the world does not even know.
Does not pay attention. Even at your workplace, somebody is not sanctioned for that. So think about people's workplaces. Think about the people who drive. They are drivers. The car, the seat is their workplace. That's their office. But the boss is smoking. So the boss is assaulting this person continuously. But the world is not paying attention to that. Think about the waitresses, the bar guys who work there every day. These people come sit, they are having fun, hopeless, right? And they are assaulting all these workers. They are not protected in their workplaces. They are not protected. Really? So imagine the children at home. You talk about domestic violence. All the time I see, domestic violence.
Who talks about the violation of a parent smoking in front of a child?
Or even a spouse. Or even a domestic worker, because this is their workplace. How come these rights of these other people are not coming up? That's what the legislation is about. That's what we're pushing for. That's the legislation we're pushing for. When we say 50 meters, it is because there was a pushback, but it should be that you should go as far away as this person should not get a whiff of your smoke. If you want to smoke, please don't assault, because this is assault. Go away. This is self-assault. It's like self-immolation. You are hitting yourself, and if you imagine you find somebody boxing themselves, you think they are mad. It's the same as using tobacco to assault yourself. Are you really okay? And so that's the challenge that we have.
Okay. We continue with that talk at this moment. allowing people to continue using this. Has the alliance come to a step of eradicating tobacco consumption totally? Have you met with government or even the policymakers to actually make them realize that we do not need this? Have you ever come that close?
We haven't come close, but I can tell you that major strides have been made. Major strides. You see, Uganda is considered an early riser country on the African continent in having what we call compliant tobacco control legislation. Globally, the world agreed that tobacco use is dangerous and must be tackled. Therefore, the world agreed on an international convention. It's called the Framework Convention for Tobacco Control. Many people call it FCTC, but you know, so the Convention on Tobacco Control is the first United Nations convention that was agreed upon by all countries. Many of the global legislations, many of the global treaties are not usually agreed upon by all countries. There will be dissenting countries. But the Framework Convention on Tobacco Control, because science has proved beyond any iota of doubt that tobacco is dangerous and it is not beneficial if you do not consume it, except for the people who are profiteering from it. So the convention was agreed by all the countries. Now, each country had the responsibility to bring that international law, that international legislation, and bring it and make it functional in the country. They call it domestication. We have done that. That's the Tobacco Control Act of 2015. The Tobacco Control Act of 2015 is compliant to the World Convention on Tobacco Control. It has very good provisions. Beyond the law, it's usually the law-making process. It asks a responsible minister usually to make what they call regulations, which are also laws really, but subordinate, and they make it clearer on implementing the provisions which are in the Act. Those ones have been done. So we have the law, we have the regulations. In fact, the tobacco industry took government to court to argue that the law and some of its provisions were unconstitutional. Because the tobacco industry is always seeking to weaken policies and all legislation that talk about tobacco control.
Or even take advantage of the loopholes in the Act itself.
Absolutely. If the loopholes are not there, create them by going to court and they strike out some of the provisions. The court rebuffed the industry. Said, this is constitutional and it's good for public health. Please leave it alone. I know that the tobacco industry will go back to court. They never tire and they have the money to do that. But we have had these successes.
Okay.
We also know now from preliminary data, and it's going to be published. If it wasn't for COVID, I think by now it would have been published. But then from preliminary data, that there has been a reduction in the rate of increase of tobacco consumption. Yes.
Well, that is something.
Yes, the data will come out. We know it's preliminary because then we have been part of the processes.
Okay.
But we know that the efforts have been useful. The other thing that I can tell you that we know is that awareness about the dangers of tobacco has more than doubled because of the campaigns that we have been mounting. And I don't want to say it's only the Uganda Health Communication Alliance. I will be telling guys, this has been a government-led effort. It's been government-led, the Minister of Health, the Office of the Prime Minister. The government have been very powerful. By the way, one of the things we benefited from most, I can tell you, is the president's opposition to tobacco use. You see, when the president voices a standpoint, it can be extremely useful for your campaign.
So actually, there's the political will to control tobacco consumption.
That's why the law could pass and it could be signed and you know, start being talked about. Now, what we have to do is the me and you.
All right. Me and you, of course, have to join government in actually this fight. And now Kenya recently ratified the protocol to eliminate illicit trade of tobacco. And where does that leave Uganda, or actually the East African community at large, when we talk about tobacco consumption?
It's actually a challenge. This tobacco, this East Africanness, despite the good things from it. Because we have the East African community, which has legislation, which has an impact on national legislation. The tobacco industry has been using that, going to the East African Court of Justice to undermine national registration. And that's a problem we have. And then the lack of action in an East African manner. We are not joined to the acting.
Yeah, that is even evident in how we are fighting
absolutely.
Corona. Yeah.
Okay, we will. That's for another day. But yes, we would be managing things like the pandemics
as a community.
Imagine the locusts. There are so many things. Imagine the Lake Victoria, which we all share. I mean, there are so many things. But on this particular protocol, on elimination of illicit trade, it's also another global legislation that is being domesticated by countries. And I can tell you that Uganda's ratification document was before cabinet, before COVID. It had already gone to cabinet. We have been discussing this. We are going to domesticate this protocol. Kenya is a step ahead of us, and we congratulate them. You see, illicit trade in tobacco does many things to a country. But the first and most obvious, usually, is any illicit trade undermines the potential for taxing these dangerous products. And these products, we always appeal that the taxes are higher because they are dangerous products. And they really have no use for consumption. So, when you are doing illicit trade, when you are smuggling, when you are doing illegal trade, it means you are dodging paying your taxes and dues to government. So government is losing income. But the other thing is that it means that the products that are coming in are not on the radar. They are not known. So even when you are trying to estimate the danger to health and prepare adequately, you are not preparing adequately because you are underestimating what is coming into the country and damaging you are. But we see the tobacco industry does not mind if the products come in as illicit or legal. Because you see, me, if I am producing my matoke and I'm selling it at my plantation and they are taking it to South Sudan, whether they cross the border illegal or not, I don't care because my matoke is getting sold. That's the same thing with the factory. Yes, because you see, whether you cross with them illicitly, for them you are buying their products and they are making their profit. Whether you government you lose or not. In fact, we have seen in previous literature from the developed world, because for them their systems are a little tighter, that in some cases the tobacco industry has been complicit in this illicit trade of its products.
Okay. Now, I want to pose a question. I want to think that we are moving together on this. From the talk we've had, right from when the interview began, I have come to confirm without reasonable doubt that actually tobacco has no use to the body. However, it has a lot of harmful effects to the body. Am I right about that? Now, after establishing that truth, I still do not know why we still rely on the notion of the fact that we benefit from tobacco consumption and production economic-wise. Should we, as a country, put forth or put before us the economic importances of what a danger like tobacco has, yet it actually has no use to the body?
You see, when you are using tobacco, or when you are using what is the other thing that they smoke in jug?
The weed.
The weed.
Cannabis.
When you are using weed, you know that it is dangerous to your body. There is no one who takes weed
who does not know how dangerous
who does not know that it is dangerous to them. But
they take it.
They still take. Same with tobacco. Because you see, tobacco, weed, those products which are addictive, which create addictions, they alter your brain to make you want them, even when you know they are dangerous. I tell people that...
Or maybe because you can access them. Because if you couldn't access them...
Addiction is a disease. Addiction is sickness. It has been classified as a disease by the World Health Organization. Once you are an addict, you have become powerless. Your brain has been altered because of the consumption of this product to want it, to yearn for it, even when you know it's dangerous. Let me tell you, the other thing is gambling, for example. Many people steal to go and gamble. Everybody who steals knows that stealing is bad. They are doing wrong. They know. But because they are powerless because of their addiction, they will still steal and go to gamble. It is the same as tobacco consumption. Tobacco has one element in its composition which goes to the pleasure part of the brain. And so when you are used to it, every time, that's why you see people say, me, I cannot sleep when I have not consumed tobacco. Me, I cannot eat, because your body has become enslaved. You have become a slave to tobacco. And I can tell you, slavery is a terrible thing.
All right. We are in the month of May, and 31st May is marked as World No Tobacco Day. Now, as we approach that day, what are your last remarks or last resolutions in regards to tobacco control?
We really hope. We have seen statistics from the United Kingdom today. I was seeing some statistics. There's been a study quickly done. I think it was the Johns Hopkins University, also in the US, that the COVID-19 pandemic has actually become an opportunity for tobacco users to quit. Because of the danger that this brings to them, it has been a motivation for people to quit. We call upon people to quit. The best thing you can do for your health is to quit tobacco consumption. By the way, I used to smoke and I quit. So that I know, I'm talking from first person experience. I'm not reading literature.
And experience is the best teacher.
Absolutely. So please, you can quit. You can quit tobacco and take all the benefits. As we come to the World No Tobacco Day, Uganda should gift its citizens by signing off this protocol on release trade. If we can do that, we shall have gifted. Uganda and Ugandans should chase those who are smoking around them and killing them. Chase them. Don't allow them to kill you. Tell them, don't kill me from here. Daddy, mommy, whatever, husband, wife, go and smoke there. If your child tells you not to smoke in front of them, I tell you, many parents will pretend that they will go away. We can avoid the tobacco epidemic and avoid it now.
All right, you had Baguma right there giving you a word of caution. Now, a word to a wise is always enough. I hope that you can actually pick a leaf from what we discussed today. Stay away from tobacco consumption as much as possible. And for you that actually find this a venture and you want to continue doing this, please do it at your own expense, 50 meters away from another, to make sure that you affect your own life and not the other community. My name is Madrin, and of course I want to thank you for being a part of the Smart After Breakfast. However, I am saddened to let you know that we are signing out of here, but Hakim Wampamba will return with the COVID-19 updates. I'll catch you tomorrow, same time. Stay safe and be kind to one another.